Hello, good evening, and welcome to the show. We're so glad to have you back with us. I have two exciting guests with a lot of information for you this evening. So I want you to sit back and be sure to take notes because both guests have so much information they're going to be providing you. My first guest is going to be Dr. Warren Schellenberg. He's the Nye County School District Superintendent. And there's so much going on in our school district, so much going on in our county, and you need to know all of that. You need to know it for your children, for your grandchildren, for your neighbors, and you just need to know what's going on. So the first thing I'd like to do is welcome Dr. Schellenberg to the show. Dr. Schellenberg, welcome to the show.
Happy to be here, Dr. Waters.
We are so glad to have you this evening. I know I have a lot of questions, but I know our listening audience has questions as well. So the first question I'm going to ask is, look, how long have you been superintendent? Where did you come from? And what is your background for this awesome job that you're holding right now?
Well, that's a lot to share since I've been doing this for over 40 years. And to do something this long, you have to love it. And I
Yes.
do love what I do. I have been a superintendent for, this is my 16th year. I started my career in Ohio, then I went to Illinois, then I moved to Arizona, and then I moved back to Nevada. I have a very diverse background in education. I have a bachelor's degree in elementary and special education, a master's degree in gifted education, and a PhD from Purdue University in educational psychology. I started as superintendent in Nye County 2 years ago. This is my third year to be the superintendent of this district.
So with all of that background, we know our students definitely appreciate all the information and all the talent that you bring to this job. So there's a lot of things that are going on around our country, and I know within our county. And as superintendent, of course, if we want answers, we either go to you, we go to the principals, we go to the teachers, but an opportunity to have the superintendent tell us and provide us with all of this information is just great. So the first question I have is, we know that many schools and our schools went through COVID. How did Nye County approach it, and how did you get through this terrible situation?
Well, that's a great question because that has been a tough battle for every school district across the country. For me, when I first came to Nye County, it was when all this was just starting. So for a while, I never saw anybody's faces because everyone was wearing a mask. So I worked with the team before school started that year, and we set up a hybrid model. So our students attended every other day, and then the days they weren't in school, they were on virtually. That worked to help keep our students safe, but it wasn't the best way to instruct students, and we've discovered that over the time that our students learn best where they're in class with the teacher face-to-face. Fortunately, I think it was this year on February 11th, they finally lifted the mask mandate. So this will be the first year I've been in Nye County where we haven't had to function under restrictions for COVID.
You know, that is truly fantastic. And it's, again, not seeing students' faces, not seeing the smiles. I know as a school administrator in Germany, one of the things I enjoyed was at the beginning of the school year, we got to see all the smiles. And as I visited the classrooms, I saw that. So I can understand exactly what it is you're talking about. And I know that a lot of our viewing audience can understand that as well. Is COVID behind you now at this point?
I think COVID's behind us as far as restrictions upon the districts. We no longer have to wear masks. We don't have to isolate students as long as we had to. When this first began, if we had anyone with COVID, we had to close down the entire classroom, sometimes entire grade levels, sometimes entire schools. So it was a massive disruption to our educational system. So I believe all of that is behind us, and I'm happy about that because, like you said, it's not the same thing to go into a school and not see kids' smiling faces. And we're happy that we can see kids' smiling faces, and I know the teachers are happy about that as well.
Well, I'm going to change the subject here because I have another question. How many schools do you have in Nye County, and what types?
We have 13 schools from K to 12th grade. We have one preschool for the district. We'd like to make that bigger and get more students involved in preschool. We think that would help with our student achievement. We have our schools in Pahrump, but we also have 2 schools in Amargosa and Beatty. We have a K-12 school in Tonopah, K-12 school in Round Mountain, and we also have a K-12 school in Gabbs and a K-8 school in Duckwater.
You know, a lot of people really don't know how large Nye County is. And Nye County is the 3rd largest county in the United States of America. And being the 3rd largest county as far as land goes, that means that you do a lot of traveling. How often do you get out to these schools?
Well, I try to visit the schools in Pahrump at least a couple times a month. I go up north once a month, and I have scheduled it so that one of our administrators is up north every week. When I came here, I think some of the northern schools felt like they were neglected and not as important, and I wanted to make sure they all felt they were valued and important to our district. So we're trying to be as visible and present in all of our schools as much as we possibly can.
You know, planning is so important. Again, for the 3rd largest county in the country, planning is important. So when you look at your future strategic planning, what are your plans?
Well, we have a goal that we had since I came to be the #1 district in this state. And that's a lofty goal because right now out of the 17 districts, we are tied for last. And I don't believe that's where we should be. And I know it's asking a lot to jump from last to first, but I believe we can do it, and that's kind of our vision and goal. We want to do a strategic plan this coming year, and that is a process that involves bringing together all constituents and stakeholders to set the goals for the district for the next 5 years, to determine a vision and mission statement for the district, and to really come together on what we want to see as our portrait of a graduate. What do we want our students to leave our district with? What skills should they have to be successful in the world today? So I'm looking forward to that opportunity to go out and collect this information, to put that together, and then at the spring, the board will approve the strategic plan, and it'll be rolled out to implement next fall.
When you talk about your strategic partners, who are you talking about, and who does it really include?
Well, we want to include as many people in the community as possible. We definitely include the parents of our district. We want to include our students and our staff. But we'll invite community leaders, religious leaders to come to share their input as part of this process as well.
Now, when you have these, are these going to be like town hall meetings, or what type of meetings, so that people know when they're scheduled? You have a lot of people that work. I know we have some retirees, but people who work and they have to get a day off, or will it be a time when they're not working? How will you schedule these meetings so that everybody can participate?
Yeah, well, the staff meetings will be scheduled after school, so the teachers are available. Students will do during the school day. Parents will probably do shortly after school's out. For community members, we'll probably hold them in late afternoon, probably after 5 o'clock, so that anyone that's working and wants to participate can. Along with what happens is they'll come together as a group, and we'll ask them several questions that they'll discuss together. And from that information, we'll put together the results of what each group decided was a focus for the district, and that's how that process works together. I think the key is, if you can't come to the meeting, we'll also have a survey available that people can fill out to give their input, because we want as many people as part of this process as possible.
Now, for those people that don't have access to this show tonight and get the information from you, if they wanted to participate in the strategic planning, how will they find out? How will they get the information? How are you going to advertise that you're trying to accomplish this?
Well, we'll send out invitations to people within our district. We will put notices probably in the paper and on our website inviting others to participate in the meetings we have or to participate in the survey so they can be a part of it. A lot of it will come from word of mouth, as this process will take most of this year to do. So there's a lot of time for people to interact and share their input.
You know, this is it's a hearty goal, and I really applaud you for taking this on because every parent, every grandparent, I think everybody within Nye County wants our schools to be the best within the state and probably within the country. So we're going to support you in everything that you do to try and get all this together. I don't have any children in the school. I'm not a teacher or an administrator, but I care about our education. How can I participate?
Well, you can participate in the survey, or you can participate in one of the community meetings we have that gives you the opportunity to share your opinion about what the district's doing well, what the district needs to do better. You know, I think the important part for us as a school district is it's such a core part of a community that the more we can do to help our students be successful, the more successful the community can be. And the more successful your schools are, the more that attracts other people who want to come to live in that community. And as the Pahrump area especially is growing, we want the school to be one of the reasons they choose to come and live in Pahrump. Truly
outstanding information. And I'm going to invite everyone, again, I want you to be sure to contact the Nye County School District, ask questions, find out more. You can go to their website and find out all the information that Dr. Schillenberg is talking about. And come back and join us for the next session. Piece of cake.
I think.
Welcome back. We're so glad to have you back with us. I still have Dr. Warren Schillenberg with us. He's the Nye County School District Superintendent. And he has an awesome responsibility of handling all the schools within Nye County. And not only all the schools, but all the administrators, the teachers, as well as all the students. And he also has responsibility for ensuring that the parents and the guardians know what's going on in our schools. So, Dr. Schillenberg, tell us about how many employees you have and all the different things that people just need to know about how your responsibility with the schools.
Well, you know, we have over 1,000 employees, around 600 teachers, over 40 administrators. That I'm sure we're one of the largest employees of Nye County. Most school districts are, but you know, we have to take care of a lot of people, and we want to make sure our staff is happy, because that makes people who are happy in their job do their job better, and so that's really important to us. So we are very proud of the staff we have and the numbers, and we appreciate all they do for us.
I have to say this. When I was offered a job with Nye County School District, I tried to let the superintendent know, look, I'm retired. I'd like to stay retired. But it's just so awesome that you have this. With the number of employees that you have, the number of principals that you have, the number of just everybody that makes everything work for the entire school district. So again, I applaud you for everything that you're doing. The strategic planning, it says right away that you've got your thumb on the pulse of what's going on in the school district. So with that, and we can all take a part by participating in the questionnaires and all the other things that you have. And I'm going to be looking forward to that because I want to be a participant as well. But is there any way that the state is helping you, because you want to go from number 17 to number 1? What is the state doing to help you get there?
Well, I can tell you what I would like to see the state doing to help us, since, you know, this year we have about 50 positions, teaching positions, we were not able to fill. That's a lot. And what the state did to help us fill them is to allow emergency substitutes with a high school diploma. You don't need any more college education. And what that does, yes, it puts a body in the classroom, but it doesn't put someone that's going to help educate our students. So it's frustrating that to solve a problem for us, I think they've just made it tougher, because we don't want just a body in the classroom. We want a certified teacher that can help our students learn and grow. And if we want to move from bottom of the state to the top of the state, that's not going to happen without certified teachers. So anything the state can do to increase the pipeline at our universities so that more and more students go into teaching, anything they can do to raise the pay, because we have surrounding states that are raising their salaries, their starting pay, some about $10,000, and that makes it impossible for us to compete with them. And we don't want to lose the teachers we have, and we want to be able to attract new teachers because we offer a competitive wage. That's really important. I would love to see the state support preschool for all. Right now, we only get funded for preschool for special education or students who are twice below the poverty level. And since we have the highest poverty rate in the state as well, many of our students would benefit from having preschool. The sooner we can get students into school and classes and start learning, the better off we'll be. And I know from working in very high performing districts, those students all go to preschool and they come to kindergarten ready to learn. We need to do that same thing for our students. And I have to say it's frustrating for me as a leader, again, coming from wealthy districts. They have no problem finding teachers because their pay is so good. It's frustrating to me that a district of poverty struggles to find teachers and the students who need it the most are the ones not getting it. That has to change, and really it's something only the state can change because they control all of our funding now. Before I came, there was a different funding formula in this state, and we had some mining dollars and we got some of the property taxes. The state has now changed that funding so that everything goes to the state. We only get money that the state gives us. So we don't have any leeway to do anything extra or differently unless the state does it. So we really implore the state to find a way to provide more funding so that our teachers can get paid better, we can keep the teachers we have, and attract the teachers we need.
You know, as you went through that, I was thinking about the national teacher shortage and how you're handling it. And it sounds like the state is making it a little bit more difficult for you because of the lack of increased pay.
Yeah.
If you have a teacher that's a good teacher that want to be here, and that teacher can make a lot more just by crossing the state line, it becomes, I can imagine, just becomes very difficult for you.
It does. And you know, it shouldn't be that you go to college for 4 years and have to work 2 or 3 jobs as a professional to pay your bills. I had a really sad story beginning of this year to me when I had a teacher contact me because her and her family live in Las Vegas. Her rent was going up $600 a month, and so she wanted to drop her medical insurance so she could afford to pay for the increase in rent. That broke my heart, and that should be the case. We should pay people a living wage. They should be able to afford to pay for insurance and for their rent or mortgage with the job they have and keep their focus on doing that job well.
You know, I have my certification in the state of Nevada, and I understand what it goes through to be certified, to become a teacher, to become an administrator, or even superintendent. So in looking at all of that, I'm kind of disappointed when you stated that the state will allow people with a high school diploma to come in and teach our students.
Yeah, and I know they did that to help, and it certainly did help to put a body in the classroom, but that can't be our long-term solution. Our long-term solution has to be, how do we pay teachers better? How do we get more students to the pipeline to be teachers, to get the training they need so they can help our students learn and grow and be the best they can be? And it's it's frustrating for me as the leader to see this happen. It's, again, creates problems I've never had to deal with before. It's really hard because, the state pushes all these issues with school improvement and meeting certain thresholds, which are all valuable. But if I have no teacher to teach these classes, it's hard to do school improvement and make it worthwhile when I have someone who's not certified to teach. So it's kind of a cycle that's I'm very frustrated with, and I'd like to see the state do something about that, because I don't need to do a school improvement plan if I know my reason for not improving is I don't have certified teachers. So help me find certified teachers, help me work with those teachers, the people we have, to help them learn what they need to learn as fast as they can. Then I can do an improvement plan.
With my certification, I know I can teach in other states. I'm certified to teach on the island of Guam and in the state of Illinois. So when I look at that, I'm just thinking about the fact that reciprocity is so important. And if it's so important, why aren't we looking at maybe opening it up so that teachers from other states can come to Nevada, especially into Nye County? They're already certified to teach and teach.
Yeah, I think that's a great idea. And I know they're looking at how they can make that process easier. But, when the certification process takes more time than it should, that can keep some people from trying this position or this option. I just hope the state looks at, again, finding solutions to a problem that's bigger than simply having a body in the classroom.
No, I agree with you completely. We need certified teachers. We need our students to learn, and the only way they're going to learn is if they have certified teachers. The other thing I'd like to talk about is safe schools. Around our country, we're having difficulties with students being safe in schools. What do you do to make sure that our schools are safe for our students?
Well, as you said, that's a priority around the country. Everyone is concerned about that. We have to find a balance, though, between keeping the schools safe and letting the kids be kids, because some of the restrictions we can put on schools can make it seem like a prison, and we don't want our schools to be prisons. So the thing we are looking at is single point entry, so that all of our schools, there's only one way for someone to enter or exit. We have a camera at the door so that someone has to buzz. We can see who they are, and they're only let in if someone knows who they are and they look safe. That's really the thing we're working to do across the whole district. Some of them we're going to put perimeter fencing because that's not there. But mostly we think that's what's going to be the solution to help us, is having that single point entry and also making sure our doors have the proper locks. We want to make sure that the teacher can lock the door from the inside, and that requires some keying changes and some hardware changes, which we are working on in the district. Again, our effort to keep our kids safe, but not make it feel like a prison.
That's the challenge.
It is.
It's definitely a challenge. We want kids to be kids. We want them to enjoy their time in school. We want them to enjoy the time with their teachers. Students have an alliance with their teachers and other students. And if it's not safe to go to school, or if students are afraid to go to school, that's when the problems arise. So I hear all the things you're doing. I applaud you again for taking on this awesome responsibility as superintendent. All the goals that you're trying to accomplish for our county. This is something that I'm glad they brought you in, because we needed your talent, we needed your background, and we really thank you for being here today.
Thank you. Happy to be here.
Okay, with that, if you have any questions about the school district, go to their website. If you want to contact the superintendent, I think you can do that through the website as well. And again, we want to thank Dr. Schellenberg for being here, and thank you, and come and join us for our next guest. Welcome back. We're so glad to have you back with us. I have my second guest. My second guest is going to be Christy Franklin. She works at Desert View Hospital. But that's not what we're going to be talking about this session. We're going to be talking about RAM, Rural Area Medical. Some of you may not know what that is, but we're going to tell you all about it. So we want you to take notes. Uh, you got to take notes and make sure you understand this so that you can tell others about it. This is something that's word of mouth that is so important for our community. My guest for this is going to be Christy Franklin. She's the house supervisor at Desert View Hospital. I have no idea what a house supervisor does. So Christy, tell us. Welcome to the show, first of all, and what is a house supervisor?
Thank you. A house supervisor does the day-to-day shift control, putting out fires all the way through the building, answering questions, handling any issues that come up, helping patients, staff.
Okay. So when you talk about being house supervisor, all the things that happen within the hospital, then they have to come to you to say, okay, how are we going to handle this situation? And as the house supervisor, you provide the answer or you gather a team together. How do you do that?
The situation, it's situational. If it's something they can handle, they take care of it and don't have to come to me. If it's an issue or a concern or something of that nature, then depending on the situation, I handle it or escalate that up the chain of command.
Okay. I mentioned Desert View Hospital because Desert View Hospital is one of the major contributors for the RAM program, whether it's cash or in-kind service. And we have quite a few sponsors that help the RAM program in our community. So Christy is here. She's standing in for Ryan Musio. She's standing in, and I've asked her all the questions that I was going to ask Ryan. So, Christy, tell us about the RAM program.
RAM is a free medical clinic services that go to different communities to help people who can't afford medical services, dental services, vision services. They come to Pahrump once a year. It takes us about a year to get everything together so that we can get as many patients as possible to come in and get dental services, medical services, mammograms, or mammogram vouchers, vision services for glasses. We see 350 to 400 plus patients every year. Just first come, first served basis.
Well, I do have to ask, though, where you're located, where do you perform all these services?
The clinic is held at the Pathway School over at 2765 South Mount Charleston Road. So it's set up. We have a parking lot out there. Everybody lines up, comes in, gets in line. So we get people registered and start sending them to the different areas. We have all different sections set up. Dental services, vision services, medical, women's health section. We have a mental health area as well. We're going to have flu vaccines as well. The county health nurse will be out at RAM this year as well.
Okay. Well, I want to emphasize some of those things because you say you're at Pathways, and sometimes I tell people it's on the campus of Pahrump Valley High School, and sometimes I say it's on the campus of Great Basin College. You can correct me on one of those. I'm not sure which one is correct, but I know it's in that area. So it's on the campus of Pahrump Valley High School or the campus of Great Basin College. But it's easy to get to, and I'm going to ask you the dates and the times because that's so important. But I want to go back to one other thing you said. You said that it's every year in Pahrump, and that's very true for everybody that wants to know that. But RAM is a program that goes to a community, and they only go once. They don't go back to that community ever until they came to Pahrump. And this is the 7th year that they're going to be in Pahrump because they find that it's so productive. So everything that Christy is saying is right on target. But we need to get the word out so that more people know about it. But Christy, you also said that it's for people who can't afford medical care. It's free, so it's open to anybody and everybody. Is that correct?
That's absolutely correct. Well, it's not actually free. It's a no cost. It's free to the clients, the patients who come and need services. It doesn't cost them anything at all. We don't ask for insurance. We don't try to bill someone else or anything. We cover this with donations, volunteers, donations of services, donations of supplies. People volunteer, and we get people from all over the country who volunteer to come to Pahrump. They keep coming back to Pahrump because the need is so great, and we serve so many people here, and we have so much community support that we're able to do these year after year.
I like the way you clarified that. It's not free, it's just no cost to the patients. I really appreciate that. And I think our community will appreciate it as well. I'm sure we have people not only in Pahrump, but in the surrounding area that will also come. This is medical care. I know you mentioned eyeglasses, and I've been informed, and I want you to verify it, they can actually give you a pair of eyeglasses that day. Is that correct?
Absolutely. So most people will walk out the door with a pair of eyeglasses. There are very few prescriptions that have to be made off-site, and those will be made at the home office and sent to the patient in about a week or so. They would have them in their hands. And we can even, if a patient has a current prescription from a doctor, they could bring that in, and we would be able to get them in to get their prescription filled as well.
This is just awesome, and just the fact that it's here every year so far for the last 7 years. What date will they be here? What dates?
September 30th, October 1st, and October 2nd, which is a Friday, Saturday, Sunday. We'll be setting up on Friday, getting everything ready to go, and we'll be seeing patients on Saturday and Sunday.
Okay. So for people that want any of the services, and I want you to run through the services again, all the services that are provided.
We provide vision with eyeglasses, eye exams. We provide dental services with extractions, cleanings, and fillings. We have medical services. You can be seen by a physician, get prescriptions for medications. Those will have to be sent to a pharmacy, and you will be responsible for that. But you can see the physician for free. We have women's health services for pap smears, annual exams, and we do vouchers that are provided from the hospital for mammograms to get those done, and you can schedule those anytime throughout the year. We also offer mental health services. If you need someone to talk to or anything of that nature, we have vaccines like the flu vaccines as well that are going to be available through the county health nurse this year.
Now, is that the COVID vaccine and the other vaccines as well?
Yes, I do believe we will be having the COVID vaccine as well. Flu, COVID, and I'm not sure what else.
Okay.
Other vaccines she's going to have. Also, we'll have resources, county resources that are available, or we'll be able to point people in the right direction if they need other services.
So a lot of services are provided, and all of these are at no cost to the patients. Uh, this is awesome, and it's something. Now, Christy will be there. Now, she's a nurse, she's an RN, and she's been participating with the RAM program for several years now. So we really appreciate her doing these things. Now, we're going to talk about, again, where it is, so people know where it is. We're going to go over the dates again very quickly. We want to do that because we want to use our next session to talk about how you can participate as a volunteer. So, Christy, let's go back and talk about where it is.
The clinic is going to be held at the Pathways School over at 2765 South Mount Charleston. I don't know if it's on the Great Basin campus or the high school campus. I call it the corner.
Okay, sounds good.
And then it's going to be Friday, September 30th, October 1st, Saturday, and October 2nd on Sunday for services.
And people can just drive in and sign up, or how do they sign up for that?
People come in, get in line, and it's first come, first serve, and we'll be moving people and getting them taken care of as quickly as we can so we can get more people in so that they can get the services they need.
And you say you see about 300 people each time?
Last year we saw 400 people. The year before it was 398. So we're staying right around the 400 number of people.
Okay. Well, you have all that information. You know where it is. You know the dates. And we're going to be covering the exact time. Some people start lining up. But again, we have all these volunteers from all over the country that's coming to serve you. And all you have to do is come out and take advantage of it. It's there for you, and we're going to tell you a lot more in our next session. So we want you to come back, be sure to write all this stuff down, and come back and join us for the next session. Welcome back. This is our final session. Every month you hear me say, I really hate the final session because we've got so much information. I'm going to try and squeeze it all in on this final session. And one of the things I'm going to ask Christy about is what about volunteers? We have all these volunteers that are coming from all over the country in the medical care that are providing their expertise free of charge. Again, it's no cost to the patients. But what about volunteers to make it work, to put all this together, all the support staff? Christy, tell us about that.
So we usually have about 200 to 250 volunteers to do a little bit of everything because we have to cover all the different aspects. Of course, we have nurses, doctors, dentists, ophthalmologists, professionals, but we need people to help support all of those people because we can't do it without general volunteers. We use interpreters. We need people to help clean, help set up, take down. There's something for everybody. If you want to volunteer, you want to help, we can find something that needs to be done. There's always something.
So if somebody wants to volunteer, how can they volunteer? And I like what you said about the fact that they don't need any special talent for anything. If they volunteer, you'll find a place for them where they can really be helpful and make sure everything else functions properly. So how would these people volunteer?
So if anybody wants to help and volunteer their time, they can go to ramusa.org or they can call 775-727-9970. If you want to go to the website, ramusa.org, click on volunteer, register. It'll just ask you your information. You can choose general support as a position, and we can place you place you in an area that has a need on the day that you show up, and you can volunteer for one day or you can volunteer for all 3 days. And if you,
Okay, and I did find out something else, and I want to share this, and I hadn't talked to Christy about it, but we had some people that were asking if they could work a half a day. And the answer was, and I'll pass it on, Christy can verify this for me, but we had a husband and a wife. They were both going to go in for the training together because they wanted the training to be done at the beginning of the shift. And then one would stay for the morning, and then the other person would come for the afternoon. But they're both trained, and that way they'd only work half a day. So instead of working a full day, some people can only afford to work half a day.
and we absolutely want people for the full day, but if you can give us half a day, we'll take it. Anything helps. Anything that you're able to do helps us take care of patients and helps us take care of our community. So we appreciate any and all help that we can get.
These are the volunteers. These are the volunteers to make everything work. And you can be one of those volunteers. Christy just gave you the website and the phone number. I'm going to ask her to repeat the phone number again in a few minutes. But you've got that contact. If you want to be a volunteer to help in any way, you don't have to be a doctor or a nurse or have any specialty training. If you want to be a volunteer to say, I helped RAM in the year 2022, all you need to do is make the call or go to the website and sign up. And once you sign up, they'll tell you exactly what it is they want you to do. You come out, you accomplish that, and then they'll pat you on the back, and you can pat yourself on the back and say, look, I help with RAM, rural area medical, for people who need it at no cost to the patient. Now, Christy, tell us more about the overall RAM program and the fact that you've been involved in it all this time. What have you seen and how has it benefited our community?
I have been involved with RAM since I moved to Pahrump, so about 5 years. This will be my 6th clinic with RAM. The patients that we help are why I do this every year. You know that you're making a difference. This isn't about cost or insurance or anything. This is about people helping people. You don't have to have a specialty to participate. You just have to have a need or a desire, a wish to help other people. So RAM goes to all different communities. They even do some international clinics that I'm not very familiar with. I'm more familiar with the national clinics. There are a lot of underserved areas that need extra help, lower income communities that need the extra help. It's not always about people who don't have insurance. It's even people who have insurance, they just can't afford all of the copays, or they can't, swing the extra copays or the extra costs involved in that. So it helps everybody, low income, the ones stuck in the middle, get the things that they need.
Okay, Christy, how about giving us that phone number and the website one more time? Give the website first and then the phone number, give it twice.
Okay. The website is ramusa.org. That's ramusa.org. The phone number, if you don't have internet or have issues with your computer, to call 775-727-9970. And that's 775-727-9970.
Okay, and one more time, what specialties are covered if somebody needs a certain thing? You mentioned dental and you mentioned optometry, but repeat those and give all the different specialties that people can have taken care of while they're there.
Dental is offered with fillings, cleanings, and tooth extractions. Vision is eye exams and eyeglasses, and most people will leave that day with a pair of eyeglasses. We offer mental health services, evaluations, or follow-up support. There is medical services. You get to see a physician, have any concerns checked, prescriptions that may need to be written. And then we have pap smears, women's health, mammograms that'll be, mammogram vouchers that'll be offered to follow up for the next year. And those are followed up by Sherry Cipollini, our medical director, after the event, after the mammograms have been performed.
Now, one of the things that Christy said, and I'm going to challenge her because she's an RN. I shouldn't say challenge. I'm just going to ask her the question because she mentioned mammogram and she said that's under women's health. Now, I know men also get mammograms, so does that include men, Christy?
If the man needs one, absolutely. Absolutely.
Okay, so men, you've heard it. There are men who do get mammograms, and you can also have breast cancer, so we want to make sure that everyone is safe. That's what RAM is all about, rural area medical. We're in the rurals, so we may as well have the medical care that we need. And there are some costs when you don't have medical care that you can get, or you want to look at RAM and say, I need something additional to what I have. So that's why RAM is there. And that's why Christy works with them each year to make sure that we in our community have access to medical care. Christy, what else would you like to say about RAM?
RAM is a great resource for our community. It shows how strong our community is with the support that they give us, knowing that we're helping people who need help. The fact that we get to do this year after year, and we always have a lot of patients. I think says a lot about Pahrump and Nye County as a whole. We have patients, a majority of our patients are Pahrump. Occasionally we get other patients from other communities or states even, but a majority of those patients are from here, right here in Nye County.
Okay, now if somebody is interested, they're going to be out there on the 1st and 2nd of October. I know you said set up the end of September, and 1st and 2nd of October, the dates. If somebody wanted to get in line, when does it open? When should they get in line? Can you tell us any of this?
The gates will be open. We'll have parking lot attendance at 12:01 Saturday morning. So late Friday night, early Saturday morning, we'll have people in line and letting people into the parking lot to get in line.
And what time does it actually start?
We start seeing patients at 6 a.m., open the doors, ready to go. We're set up, and as soon as we start moving patients.
First come, first serve. Are they still in their car? Are they driving up? Are they walking up? How are they handling that?
They are driving up, parking, and getting numbers to go in the door.
Okay.
Or just going and lining up and going in the door.
This is great. Again, this is RAM. This is Rural Area Medical. I'm going to say October 1st and 2nd because everything else is set up. If you're a volunteer, it could be the day before because for volunteers, they need to have the setup. They need to have all the cleanup. So they're definitely looking for volunteers. If you want to volunteer, she's given you the website. She's given you the phone number. Be sure to contact them if you want to volunteer. If you want to be one of the patients, be sure to be in line so that you can get a number because it's first come, first serve. I want to thank Christy for being on the show this evening and providing all of this information about RAM. Christy, anything you'd like to say in closing?
Just come on down. We'd love to have as many volunteers as possible so we can help even more patients this year.
Thank you, and we'll see you next month.